A new report finds many people, both young and old, end up in the emergency room due to the misuse of their medications, sometimes in cases end in accidental overdoses. Dr. Seema Bonney, an emergency room doctor, has witnessed the impact of this and joins us now with more on how to avoid this from happening to you. Good morning.
Morning, Maureen.
Let's begin with this JAMA study that came out. In a nutshell, what exactly does it say?
The JAMA study is telling us that we basically have an over-reliance on medications, and also when we're prescribing medications to patients that we're not educating them sufficiently about how they should be taking it, and some of the adverse outcomes that can happen if they don't take it correctly.
As an ER doctor, you see a lot of this in the emergency room. What are the combinations of drugs that you're seeing people most misuse that lands them in the emergency room?
That's a great question. There's a few different combinations of medications that cause a lot of problems and often lead to ED visits. One is, for example, opioids, which is a class of medication that's used to treat pain. Another is central nervous system depressants. This is a fancy term for groups of medications like tranquilizers and sedatives and benzodiazepines that's used for anxiety and sleep. Another category would be stimulants that are often used to treat attention deficit hyperactivity disorder. We see a lot of ED visits related to hypoglycemia or accidental low blood sugar related to diabetes medications. And in our younger population, our kids, because of antibiotic misuse, we'll see adverse reactions related to antibiotics like allergic reactions, hives, GI stress.
So, you know what concerns me is, of course, you have prescription medication, but there's so many of us who take non-prescription medications. And I always wonder, at least worry, what should I know about that? And mixing them could potentially be harmful, but how do you know?
That's a great question. And the truth is we do see in the ED a lot of, visits related to either over-the-counter medications reacting with other over-the-counter medications or over-the-counter medications reacting with pharmaceutical drugs patients are taking. And patients don't even realize sometimes what are in these formulations. So say you're taking over-the-counter ibuprofen, but you're also taking some, concoction, that's anti-inflammatory that also has ibuprofen in it. Now you're duplicating the active ingredient in both, and that could potentially lead to some, kidney ramifications. Other times patients often take Sudafed, which can spike your blood pressure and then counteract the pharmaceutical medication that lowers your blood pressure.
So in our last 30 seconds here, leave us with a nugget of hope. What can we do, bottom lining it, when it comes to knowing about, medications and trying to avoid a trip to the ER? What's that message?
So I've been actively practicing board-certified emergency medicine physician for 21 years, but I also practice functional medicine, which looks at the root cause of symptoms we have. And I think that this JAMA article underscores the importance of being really judicious about prescriptions that you're giving patients. Do they really need it? Right. We know that with type 2 diabetes, it can be reversed with 10% weight loss and exercise. Anxiety, sleep disorders, all of these things. Are we addressing sleep hygiene? Are we addressing mindfulness, meditation? Are we doing all those things before we're prescribing? And then when we do prescribe, are we sitting down with patients and explaining to them carefully, what can happen if they don't use that medication properly?
All right. Great tips, great insight. Doctor, thank you so much for your time this morning. We appreciate it.
You're welcome. Thanks for having me.
Absolutely.